As consumers are considering healthcare coverage options for 2019, they may stumble upon a couple different types of health plans. Not all of them are insurance. We're going to talk about healthcare sharing ministries today as one such example of that type of plan. Now, a healthcare sharing ministry is not insurance. It's not regulated by the state insurance commissioner. Agents or anybody that sells such a plan are not licensed. There is very little oversight of this world of health plan. In fact, it's not insurance at all. It's grouping people together, usually under a shared religious belief, which is where the healthcare sharing ministry title even comes from, where members of such a plan pay monthly premiums or shares to cover qualifying medical expenses as determined by the company that instigates the plan of other members. There's no legal obligation of the plan to actually pay any member's costs should it be requested. And in fact, many consumers consider themselves to be self-insured and actually seek self-insured discounts from providers before the healthcare sharing ministry might even reimburse that individual. 30 states have safe harbor rules that exempt these plans from state insurance regulations, and Wisconsin, where we are, is one of those states. In Wisconsin, we only require plans to provide a written disclaimer and monthly statement of member dues or contributions to people that participate in such plans, but really the state doesn't keep any data and largely doesn't know about the plans even in operation unless something goes really, really wrong, and we'll talk about that in just a moment. These plans sometimes have requirements. Some might require members to commit to religious principles. Some might have to sign documents agreeing to live healthy lives and comply with some moral values as established by the plan creators. Some go really detailed about promising to go to church. There are some plans that have that explicit in the language, and it has to be affirmed by the church leadership. Other plans are not as strict down this line, but some might just have an agreed set of beliefs that people have to sign off on when they enroll in such a plan. As you can imagine, because this falls under a religious category, there are some restrictions in what can actually be paid for, and largely across most healthcare sharing ministry plans, abortion and AODA services are not going to be covered. But guess what else might not be covered? Pre-existing conditions, prescriptions, preventative care. There is no rule that these have to comply with essential health benefits or any of the protections of the Affordable Care Act because, once again, this is not insurance. Individuals with these plans are exempt from the Affordable Care Act's insurance individual mandate. And one plan executive in an article was quoted as saying, "We've abandoned the health insurance model and instead we rely on each other to pay our bills." Kind of, we're all in this together, we're going to help each other out, which is a nice gesture, but also if you're looking for accountability and getting bills covered and a contract that will help make that happen, that's not what you're going to find in this arrangement. There are concerns with this, as you can imagine. First of all, is it mimics insurance in its design by saying you pay premiums and we'll consider reimbursing your care, but it is not insurance, and therefore it can be quite confusing to consumers that sign up for something that sounds like insurance and then it doesn't work like insurance. It can discriminate based on health condition, which means that coverage can be denied to people with pre-existing conditions, coverage can be capped, coverage doesn't have to be provided at all, it can be very skimpy in its provision of coverage if there is any, and that leaves people with surprise medical bills, where you go in saying, I have this healthcare sharing ministry plan, but then you get to the doctor's office, you have a procedure, and you get the bill in full for that procedure, and you thought you had this to rely on. It distorts the risk pool as well, just like short-term insurance, association health plans, and some of those other limited benefit or not full comprehensive coverage insurance policies would do, because they are typically a little bit cheaper. So that means you're not paying as much. You think you're getting comprehensive coverage. You're pulling people out of the full risk pool, and instead you're leaving the Affordable Care Act risk pool as the sicker, more expensive risk pool, and the healthier people start going towards the cheaper plans, only to later be surprised by medical bills that they thought would have otherwise been covered. Like we said, states are not collecting data on these types of plans because there's no one running the show. There's no insurance commissioner to get involved to regulate these plans or take stock of how they're doing or how they're treating consumers. Most states have no idea of the scope, magnitude, or the plans in their state. They only learn of a plan if a consumer complains to the insurance commissioner, and the insurance commissioner's first response is going to be, hey, we don't regulate these plans, but only if there's an instance where there is extreme fraud, can anything really be done? It's probably going to be deferred to the Attorney General of the state to investigate that company to see what kind of fraud and the extent of the fraud that happened. So is there a recourse for denial of care or coverage? Typically, no. Now, a quick side note that healthcare sharing ministries are not the same thing as church plans because they both fall under that very broad religious category. They are sometimes confused with each other. Church plans you can think of more as being association health plans, but for churches where they can group together and fall into the category of group coverage. Typically, they will not have to follow ERISA rules because it's group and not individual coverage, but typically also they are not exempt from the Affordable Care Act where it intertwines with the IRS rules. So even though it's not the same level of scrutiny that other group or individual plans might have, church plans have some accountability in some of the rules that are integrated from the Affordable Care Act into the IRS code. Now still, that level of scrutiny is not as heightened as it could be, but just so you know in your mind, the two plans are distinct. You can read a couple of reports that have come out on healthcare sharing ministry plans and some church plans, the distinctions, and read up on a little bit more if you have questions. You can also send us your questions or an email, and you can do that at healthwatchwisconsin.org.